.org. It stands for Reimbursement Premium Adjusted Yields, so-called account-based organization sponsored by a non-profit organization called Foremost Organization. This is Consumers Dr. Bengala. Thank you for joining. Today's topic is healthcare consumerism. Healthcare consumerism. You are a health insurance consumer. Efficient free market always respond to the consumer's demands for products, services, and information. It is time to try a system that focuses on consumer and the patient's needs. Someone will tell you, some will say, we have tried the free market approach years before Obamacare. But you know and I know, pre-Obamacare was not a free market. It was never a free market prior to Obamacare. You and I know it was a bad system prior to Obamacare. Before Obamacare, the healthcare lobbyists had their way. I'll tell you what it was like. The structure included the laws such as, number one, consumers were powerless when seeking to purchase coverage. And number two, insurance restricted providers and services patients could access. And number three, cost and quality information was hidden from all of us. And number four, individual consumers had no power to negotiate premiums or understand why they were rejected in the first place, for coverage in the first place. And number five, few powerful insurers limited coverages, provided alternatives, planned alternative choices, innovation, and pricing competition. Very few of the insurers with the limited coverages and provided alternatives, planned choices, innovation, and price fixing. Very few providers. And you and I know that laws and regulations were mostly written by insurance industry lawyers. Yes. With the limited competition and large market share, which drives the prices. That's how the costs were going up. Consumers were ignored. Believe me, folks, we don't want to revert back to the old system. We can't let industry lobbyists write the laws of post-Obama care. You know why? Consumers will be shafted again for the second time. We're not going to let it happen, folks. We will never let it happen. If you are a consumer, efficient free market always respond to consumer demands for products, services, and information. We never had a free market for health insurance. We never did. It is time we try and focus on the customer and the patients. We need to focus on customer and patient, yes. Consumer driven, patient centric. Politicians and insurers are they're not working to help you or me, folks. Yes, they're not helping you or me. Politicians have been promising repeal and replace plans for over 10 years now, yet nothing gets done. Nothing gets done. Politicians are either unable or unwilling to develop alternatives to Obamacare. Since 2002, insurers and their lobbyists have been fighting hard against expanding account-based plans, so-called health savings accounts. You know why? Because health savings accounts puts control into the hands of the consumers. They have been fighting hard. They don't want consumers to be in control. Lobbyists and existing vested interests will always preserve the status quo and work against your interests in choices, treatment options, and affordable insurance. Affordable insurance. It is time to demand that acknowledges your unique needs of personalized health insurance. Time has come, folks, for personalized health insurance. It has to be consumer driven, patient centric. Personalized health insurance is an approach to get insurance you want when you want it at affordable price. You and I, you and I want coverage, improvements, affordability, and more treatment options and healthcare options. More treatment and healthcare options. We all want more options. It is time we take that control back. We can't let a government or insurance bureaucracies come between you, patient, and provider relationship. They should not come in between patient and provider relationship, between you and your doctor. They cannot. They cannot. We cannot let them set rules and tell doctors what they can and what they can't do. They cannot be allowed to say who we can see for our health care and what treatments we are prescribed. Personalized health insurance will improve the delivery of care, lower premiums, improve quality of treatments, and add new choices. Add new choices. As for coverage, personalized health insurance includes most popular Obamacare consumer-oriented features. Yes, we're going to adapt the consumer popular Obamacare features. What are they? I'll tell you what they are. Number one, guaranteed issue of insurance. Yes, we need to have a guaranteed issue of insurance. And number two, coverage of pre existing conditions. And number three, dependent children coverage to the age of 26. And number four, unlimited lifetime maximum. Lastly, number five, comprehensive major medical insurance coverage, folks. Comprehensive major medical insurance coverage. Personalized health insurance builds on the strengths of this country, folks, of this country, United States. It includes efficiencies, innovation, choices, consumer focus for a free market with consumer protections, patient and empowerment, and limited government oversight. Basically, it is a public-private partnership, folks. Public-private partnership. It should not strain the government. That's the beauty, folks. We have come a long way in healthcare. We need to deregulate the healthcare. Every year we get healthcare is the most overregulated industry out of all the sectors. Healthcare is overregulated. I have no idea. I understand it's a personal health, but every time the Congress or the state passes a new law, it costs the government because you need to create people to monitor. Yes, that needs to be changed, folks. We need to deregulate the healthcare industry like what we did to our airlines. And number two, this billing system needs to be gone. Billing system. That's why I'm proposing account-based setup. Everybody should have an account-based health savings account, so-called rainy day fund for the future healthcare of you and your family. Very important, account-based plans. And number three, basically, insurance concept itself, you share the risk among the same categories. Right now, insurers or insurance companies are fighting back in segmenting risks. They don't want segmentation, folks. Right now, the risks are across the entire United States. You're paying for your neighbor's problems. You're paying for someone else. It doesn't matter. You're a man or woman or transsexual. It doesn't matter. Your premium is risk shared among entire 340 million people, folks. It does not segment. I'll explain to you in detail. The scenario is we need four categories of risk segmentation. Your insurance premium has to be broadly be based on segmentation. Number one category is well category. 63% of the United States population are healthy. Their claims are only 12%. Their premium should be based on that. Second, at risk, like people are exposed to at risk, like hypertension, diabetes, smokers, drug addicts. If they're at risk, their premium should be based on that. At risk categories is only 15%, folks. Their claims are 20%. Their claims, medical claims are 20%. And the third category, this is where our cost is rapidly rising, is chronic illness. If you really look at chronic illness, folks, what percentage of the people have chronic illness? 15%. But their claims are almost half, 48 to 50% of the claims. All the claims you put together, people with chronic illnesses are billing. So those claims are a lot higher. So we need to focus on this chronic illness category, bring down the lower premiums, focus on them, and try to see how we can lower the premium in the chronic illness category. That's where the cost keeps rising. The last category is catastrophic. Catastrophic when you're exposed to something like you're a pilot or you have a cancer, you have something, you have a catastrophic illness. That is only 1% of the entire population, folks. And their claims are roughly 15% among the catastrophic. So if you segment the rest, the premiums will go down, folks. Through account-based plans, if everybody has account-based plans, and get rid of this billing system. There are 9,000 billing companies, folks. Billing companies, all the billing companies are making profits. And these mid-level agencies, so-called managed care organizations, need to be gone because that's what is raising the cost of the care. We need to have a public-private partnership with health review authority taking care of the folks who need the most, who are impaired. We need to focus on the impaired and people with chronic ailments. That's our focus. If you really look at the people who are impaired and chronically ill, you're talking about the impaired group, it's only 2 to 3%, folks. 2 to 3 economically impaired. I'm talking about economically impaired and physically. Only 2 to 3% of the entire population. But we are punishing all Americans to cover the people who don't have insurance. We have 27 million uninsured. And right now we are spending $3.8 trillion annually, which has surpassed the national defense budget. It's disgrace for the United States. It's a disgrace for healthcare. That costs are so high, and we rank 38th in the world among the advanced countries. Can you imagine after spending that kind of money, we still rank 38th, folks? We are not number one. I want to see the United States where they excel the most is consumer driven. Every time we are good at consumer driven retail sector, consumer driven agriculture, food industry, and it has to be consumer driven healthcare sector, folks. I hope I have given you the right message. I'll continue to strive towards the consumer driven healthcare. This is my lifetime passion, folks. This is what I want to do. I'm retired. I have been in the healthcare for the last 40 years. My goal is consumer driven healthcare, man. That's all. Sugar. We'll continue to do that. And thank you for listening. Thank you for joining. And we will see you in the next episode of rpay.org. rpay.org, which stands for Reimbursement Premium Adjusted Yields. Basically, it's a reimburse you premiums will be reimbursed. Whatever the healthcare you pay as you go, and you will be fully be reimbursed for whatever the payment you made through your health savings account. Again, thank you. We will see you in the next episode of rpay.org. This is Consumers Dr. Bengala. Goodbye, God bless, and salute.